the ventilation and air quality module. Again, health issues related to indoor pool environments and pool use. We're seeing increasingly more incidents of health effects because of air quality in indoor pools. A variety of reasons for that. But this module is a step towards improving indoor air quality at these pools so that ultimately we're going to reduce those illnesses associated with that environment. Some of the key elements of that module, and again, you may have seen this for those who have taken the opportunity to review it and or provide comments. Notice the properly designed air distribution system. You can have adequate air volume, but if you don't properly distribute it around the pool, if you have stratification or other issues, you haven't really accomplished what you intended to accomplish with ventilation. So it addresses that aspect of it. There's a requirement for increased makeup air for certain types of pools, increased over the industry standard, the ASHRAE standards for indoor pools. And that's really based on, the committee did a lot of good work on that. Okay, what causes, what is a pool a pool a pool? Flat water pool, the same as a spa pool, hot temperature, or something with your indoor spray jets and all of the aerosolization. Is the impact on the air and what goes into the air the same for all those? No. So they took that into consideration and developed the air makeup requirements, acknowledging the differences of the type of aquatic venue that's being served by that space. And also, that's the third item highlighting that. There's also inclusion in the calculations for enhanced air of some new technologies. I know where they're actually taking fresh air from the surge tank or right off the gutters so that you're pulling that out before it even gets mixed in with the natatorium air. So there's an attempt to acknowledge new technologies that may improve it. And so instead of sticking with the same box, here's how we've done it. Again, looking at what's coming up, what are the issues, can we address that? So the attempt to include that in the module 2 to acknowledge that. And as you probably all know, that what's in the air is largely, in part, dictated by what's in the water, our water chemistry or contamination burden. And we probably wouldn't really have to deal with ventilation very much if bathers all had a nice warm shower, took, soaped up, cleaned off, and it goes back to our contamination burden. We've got an uphill battle on that, and the combined chlorines and all that is all from what's coming into the water, your precursors and that. So there's acknowledgement in that. And even though it isn't directly ventilation, it directly affects ventilation. So they felt that it was important to acknowledge that. So an implementation of plans to reduce combined chlorines in the indoor pool and inform facility patrons of their impact. If you don't shower, if you urinate in the pool, the sweat, all that contributes, and your stinging eyes and the odors in the air are because of what you as a patron are doing in that facility. So an attempt, again, we all know it's probably a great uphill battle, but it's one I think we have to tackle nonetheless. So try to get the bathers as part of this and understand their role. They can't, you can't have an operator take all the responsibility and have the systems designed and then have the patron come in and everything's out the window because of what they do or don't do in there. So we need to empower them and have them part of this fix and this process. And again, a couple last key points is the humidity and temperature levels in an indoor pool for ventilation. They've got some details on that. Next module I want to speak to is the risk management and safety. Again, this one's been released for public comment. And increased vigilance needed at aquatic facilities to reduce the injuries from either water, your chemical storage, your safety issues in and around the pool. So that's what this module is dealing with, those various aspects from a risk, safety, and management standpoint. Key elements. Controlled access. If you have a leisure river, the only place you can get that leisure river from a patron standpoint is this one entrance point. Historically, typically, health codes require depth markers every 15, 25 feet around. So you got hundreds of feet of leisure river. The patrons only see it at one point. Does it make sense to have the same rigor of depth markings? So this code is saying no. Looking at the risk, and so it should be maybe minor, but a relaxation as far as your designers and operators and that. If it doesn't make sense, you're not accomplishing anything with that, do we need to have it in there? Expanded employee training to cover fecal and vomit-related pathogen response. Big issue. Prescribes, I shouldn't say prescribes, it's a bad word, but has details on how to respond to that and incorporate that into management plans at your aquatic facility. A big issue also that we see from operation that really affects safety, drownings, is your lighting, your glare, ways to prevent glare. I know from a personal experience doing drowning investigations at our pools and beaches, glare is a huge factor. We design this, and I see all these, this is my own personal pitch on here, but I see these in all the trade magazines and the beautiful natatoriums, award-winning natatoriums. What I see, the only thing I focus on, here's these windows, here's this glare, I can't see below the surface. So we've got these award-winning designs, they're beautiful, but you've built something that a lifeguard is going to have to deal with for the rest of the time that this pool is in operation. So we'd like to acknowledge this in the design, not say you can't have windows, but this talks about sources of glare, and you'll see this in the design and operation module too, and ways to prevent glare if you do have it, so that your guards aren't set up for failure before they even start. Important safety issue there. And consideration of water temperature and patron use, whether it's your spa pool or some acknowledgement and discussions in the annex of what different, not prescribing temperatures other than a maximum of 104, which is kind of generally accepted from a spa pool, but just general temperature ranges for pools. But those won't be then regulatory, but a discussion of those temperatures. Expanded chemical storage and handling information, again, from a you folks probably see it, whether you're regulators or operators. We, despite best efforts, you have chemical mixing. Sometimes the storage rooms aren't set up to really give you a good ability to control your chemicals and spillage and mixing. So discussion on that. Use of remote monitoring systems acknowledged. Two different remote monitoring systems. One is the lifeguarding type, where you're underwater monitoring. It acknowledges that technology. It's not going to allow that in lieu of a lifeguard, but as acknowledging what it can do and where it fits in, and the remote monitoring systems for chemical controllers. Again, it won't be in replacement of daily or periodic checks, but it's acknowledging the value of them and having some information on how they're integrated in the system. And employee illness policies. Again, if you've got a guard come to work sick, diarrhea, what have you, they're going to be in the water. Are they any different than your patrons? So that needs to be addressed from a risk management standpoint. And some daily inspection items for you for opening and closing a pool. Just again, a lot of this should make common sense, but unfortunately isn't done out there routinely in all the facilities. Facility maintenance and operation. Again, this one that will be released next week. Operation and maintenance, obviously, a critical component of whether your facility is maintained in a healthy and safe manner. This module addresses some of those issues. Closure and reopening guidance for long and short-term closures. I guess some of the current concerns. If you're closing your pool down for a couple days, is it okay to turn your filter and your disinfection off? If it's 2 days, is it 7 days, is it a month? You know, what does that do to water quality? What are other safety-related issues? So there's a discussion, guidance on that aspect. And importantly, a comprehensive plan, preventative maintenance plans for the equipment inventorying and development and operation manual. It seems, again, intuitive, and probably most of the folks here that are operating facilities, this is second nature to you. But unfortunately, there's a whole universe of diverse knowledge base and attention by operators out there. Simple thing, we've used this as an example, but this preventive maintenance plan. One of the common, if you heard Michelle Lavsa's presentation on inspection problems, what do you find? Inadequate or absent chlorine residuals. Very often you'll find out that the chemical feeder is not working. Take an example of a peristaltic type feeder. Those tubes are only good for a certain period of time. If that tube ruptures, if it's not replaced routinely, it's set up for failure. There's a limited time on that. Preventative maintenance plan could acknowledge up front that per the manufacturer, what have you, I've got a certain period of time and that has to be replaced. So you don't react after you find the health inspectors there and you find no chlorine in the pool and you go back and find, oh, my tube is broken. You've got to plan up front to proactively, preemptively deal with some of these issues. That's the goal of that type of preventive maintenance plan. See in here too, the reducing and mitigating, there's that glare issue again, excessive glare and reflection, ways to adjust some of the concepts of what causes glare. A lot of this is an annex discussion too, not regulation, not part of the regulatory, but here's the annex, here's the explanation, the whys behind the whats, some good information. And again, comprehensive daily records of the pool operation, maintenance, and operational items to be inspected daily. Those are some, again, highlights. Next module we want to speak about is the hygiene facilities module, your bathhouses. And swimmer hygiene is a critical component that plays a role in some of your documented waterborne disease outbreaks and poor water quality. Again, if your bathers come in, they don't shower, if you don't have handy or adequate toilet facilities, I've seen this. If you don't have diaper changing stations, your parent, what's the parent to do? I've seen them with the spray grounds, of course, when we caught up that we changed this, but there's the parent at a spray ground, diaper kids holding the kids up under the spray ground to wash their bottom off in there. That's, why are they doing that? Is there information gap, or is there not conveniently located toilet facilities? Is there not a diaper changing station? We see that at beaches, in any of the aquatic facilities. So we can't make everybody totally comply, but if we don't have the equipment and the facilities that are adequate, clean, then we're lost before we start. So minimum distances for hygiene facilities from aquatic venues, we had a lot of discussions on that. We had, like I said, on our steering committee and technical committees, representatives of water parks, of community pools. So how do we accomplish our goal? Here's our goal. Let's not be crazy about numbers and distances, but what makes sense. So that's dealt with in here, and highlighted diaper changing stations, because there's a lot of pools out there that don't have them. And one of our steering committee, it kind of really hit home. Before he even got involved in this project, the designer, developer goes out and he's got a diaper age kid. You go out and you go to a restroom, you got to change your child's diaper. First of all, do they have it? Is it something you'd even want to set your child on because of the condition of it? You set them down, you take a dirty diaper off, where do you put it? There's nothing. You get done with that, you need to wash your hands. Is there a sink there? What do? Are you going to leave the kid alone on the table? So all these things that I think are commonly not there, not adequately provided or maintained, which, as we know, a lot of our discussions in the last day and a half are recreational water illnesses, UV, crypto. Well, how does crypto get into the water? Here's the link back to hygiene facilities. Here's a way to let's keep it out before we have to treat it once it's in. So an important component, we feel. And an implementation of rinse versus cleansing showers. Probably your experience, we put showers, or those that require showers, what do the patrons think it's for? Wash the chlorine off of them after you get out of the pool before they go home. What do we want it for? Wash the junk off before you get into the pool and create your chlorine demand, your precursors to disinfection byproducts, all that. So, but we also acknowledge can we reasonably expect warm water showers and people to soap up and before they go in the pool? It'd be nice, but it's not reality. There's been research done that shows that even clothed, with your bathing suits on, which is cool water, no soap, was a huge percentage of reduction of the contamination burden off of a body. So even it may not be the same as a full warm water shower, it goes a long way of reducing the contaminants entered in the pool. So we acknowledge that. We talk about spacing. They don't have to be warm water. It doesn't have to be soap. So spacing around a facility so that people can wash off. You're running around a water park. You're running around a community pool. You're coming from the playground, sweaty, dirty, sand, place that's convenient to rinse off that major contaminant before you get into the swimming pool. And then we do acknowledge the cleansing showers, which would be more in your bathhouse facilities. Okay. The regulatory program administration module is really, it captures policies, procedures, and in this also is guidance to the health departments on what would be considered a model regulatory program. And it provides the framework for an effective model health code. One of the items in there is an establishment. This, again, would be at a local level, say a county Health Department, state level, of establishing an independent aquatic health advisory committee. How often as designers or an operator you go to the health department, you have this plan, and it's rejected. I want to do this, they say no. Well, this advisory, the thought behind that is let's have an advisory made up of the different, not just regulators, but the industry. It's a standing body, and you can bring some of these issues to them for a review. And then they provide essentially guidance and information to the health department on how to deal with some of these issues. If you've got a variance or waiver procedure, can there be alternatives? So that concept is being floated in that module. Also, defining imminent public health hazards is included in there. What are we've got a lot of items that you're responsible for in a pool. What are the critical ones? Ones, if their existence is likely to lead to injury, illness, or death. Like no chlorine in the pool, illness, certain diving, say if you have a diving board in 3 foot of water, that's an extreme, but those type of things where the existence of a particular condition is likely to lead to injury. Those are highlighted, and those have to be taken care of. Those are the ones we'd expect that the operator should be, by putting them in the code, the operator is aware of what the critical items are, so hopefully they would never let them occur in the first place, but it's clear, and it's clear if you find this, the pool or that portion of the pool is closed until those are, the remediation is there, the correction is there. This is, in this module, too, is where the facility staffing requirements are, whether it be, like I said, the trained pool operators, the lifeguards, other staffing requirements are contained in this particular module. Again, from a regulatory standpoint, guidelines for plans and permits. If you requirement to submit plans prior to construction for a new or modified pool, what are the components of a plan submittal? That's detailed in there. Permitting, application, all the administrative type things to administer a program. Record keeping requirements, daily operation, monthly operation reports, in-service training, all those variety of type of reporting is contained in there. And again, an important part is swimmer empowerment methods. We need to get the bathers, the public, and as part of this process, like I said before, they can't just rely on the operator, the designer, and the health department, think everything's fine. If you don't have everything we do can be undone very quickly by what the swimmers do and don't do in that pool. So we want to have a process to try to empower them to be part of this process. Disinfection and water quality, again, critical to maintaining bather health and comfort. Again, this is draft, and I have to make note that the version of this PowerPoint that is on your CD, there's a little change, and I'll tell you what it is on here. There's some erroneous information, but basically this is primary disinfection, your chlorine, bromine level, and it specifies what chlorine, bromine levels are required. It talks about secondary disinfection when you have our increased risk aquatic facilities, those that basically diaper-aged children, or those where you're likely to have a fecal incident. Those are at higher risk for disease transmission. We're looking at a mandate of secondary disinfection, UV ozone for those particular venues. Important point to stress here that most of what we're talking about on these design is for design of new facilities or renovated. This is not, vast majority, other than some operational type things, are not intended to go into effect and retroactively apply to everything in existence. Most of this, especially in operation and design and these type of things, you build something new that meets this definition, then you put it. You don't go back right now to everything, because again, the evolution, not revolution, that would turn the industry upside down, the cost impacts on trying to bring things up to standards. Maximum, again, draft, subject to public comment, subject to further interaction between steering committee and tech committee, allowable combined chlorine levels. And this is the fourth one, is where there's a slight correction. The prohibition of cyanuric acid at any venue that requires secondary disinfection. It's not a prohibition, period. It's those where we need UV because of the risk. The version that was printed said there was a MAC for where it was allowed, it was 50 parts per million. That's not accurate. again, there's looking at the research, there's more that needs to be done, what's an acceptable level, and I think the last, and again, it's not finalized, would be more up in the lines of 100 parts per million based on, if you can't defend a number, then we have to wait and see. So we've got to, that's under further research. Lifeguarding, bather supervision. I can't give you particulars right now because, again, this is in the process of being developed, more finally developed. But looking at what are the lifeguard and unguarded facilities, acknowledging what's guarded, what's unguarded, and what are some of the requirements under those categories. Similar to the pool operator course, it will have, if you want to be a lifeguard training provider, what are the core elements that need to be included in a lifeguard training course, what your instructor quals are, and your ancillary or accessory, the CPR, AED type training that may be needed. Staffing, attendance, what particular lifeguard equipment's needed, the placement of that equipment, first aid equipment, and then the guidance for unguarded facilities. You know, if you're not guarded, kind of just finding when it's guarded, when it's not guarded, and if you're unguarded, what's the appropriate equipment needed to properly attend to that. And design and construction, kind of an overview, an awful lot in there, but as we say, we're trying to get the science and engineering behind that. We're looking at the physical design and construction requirements, shell and all that, and again, being particularly attentive to what should be in a building code versus what should be in the pool code. So very careful look at that type, and you can see here identifying those issues that are electrical or structural or something that should be a building code issue. Again, conclusion, planning for the future. Here's what we're hoping to accomplish by this. Strategic planning for future transition. I'm going to be developing the structure for continuing that. Here for more information, here's a website on how to access some of this information, the model code. And one of the things Tom Lachaki talked to us at the beginning of this conference, what's your take-home message? What do you want to re-emphasize? The key item I want to emphasize to you folks is be involved. This is your code. We need you to be reviewing these modules. It's not lip service on your comments. Each and every comment is posted along with the name of the person, and we've got very good information from comments, and we've made modifications. The technical committee, steering committee, we're just a small subset. There's a couple hundred people through that, but there's thousands of you out there, and you need to be part of this. This is your code. It's our code. Follow up on the modules. Get the comments in, and I just encourage you to share that information and make sure you get your voice heard and be part of this process.